I am Jamie,
Amanda.
Nicole, and we're going to be demonstrating the lumbar spine. I will demonstrate the AP projection.
I will be demonstrating the obliques.
I will be demonstrating the lateral lumbar spine.
And I will demonstrate the L5S1.
Okay, I'm going to be demonstrating the AP projection of the lumbar spine. Clinical indications are pathology of the lumbar vertebrae, including fractures, scoliosis, and neoplastic processes. You want to make sure that your tube is 40 inches distance from your bucky. We're going to use a 14 by 17 cassette, and you're going to line up your tube to the bucky before you get started. Once you've got that lined up, you can actually just move the patient instead of moving the tube. You're going to make sure you shield the sensitive areas, thyroid, and the genital area. The patient's going to be supine with their arms at their sides, head on a pillow for comfort, and you're going to flex their knees with, you can use a lucent sponge to reduce any curvature in the spine. You're going to feel your hip, if that's okay, ma'am. Always ask for consent, and you're going to feel for the iliac crest, and you're going to center the tube, central ray, to the crest at midline. And you're going to open your collimation, collimate, four-sided collimation, top to bottom, and close in on the sides. And anatomy demonstrated is the lumbar vertebrae, the intervertebral joints, and transverse processes. Make sure the patient's not rotated and they're aligned straight. Before you expose your patient, you want to make sure that you mark the appropriate side of anatomy, and you're going to put it off to the side so it doesn't obscure any anatomy. For the AP position, you're going to use a kV range of 85 to 95 kVp. And you suspend breathing on expiration.
Okay, I will be demonstrating the posterior obliques for the L spine. The pathology would indicate any defects to the pars articularis. So you want to have your patient in the supine position and make sure that the tube is at 40 inches from the bucky. The cassette, you can use a 10 by 12 or 11 by 14. You want to make sure that they are aligned. You want to have the patient pick up their knee and have their arm reach across their chest to ensure equal rotation of the hips and shoulders. You want to use a radiolucent sponge so you can have your patient at a 45-degree oblique. You want to make sure that your patient is centered midline of the table. Okay, so I'm going to feel for the crest, and you want to center in about 2 inches, about 1.5 to 2 inches above the crest, and maybe about 2 inches medial of the ASIS. One collimate on 4 sides. And you want to put the marker with the side down. So it will be the left. And just make sure it's out of the anatomy. And just have patient take a deep breath in and let it out and expose on expiration. Their arm across. Ensure equal rotation of the hips and the shoulder. Again, you just want to feel for the crest to make sure you're 2 inches above and 2 inches medial of the aces. Collimate in again, and this time you change your marker to the right side down and expose on expiration. With this projection, the zygopopliteal joints and Scotty dogs should be visualized, and you want to use an 85 to 95 kV range.
I will be demonstrating how to position for the left lateral lumbar spine. And for this particular position, for the pathology demonstrated as the fractures, spondylolisthesis, your neoplastic processes, and osteoporosis of the lumbar vertebrae. And for this particular one, you're gonna have about 85 to 95 kV range. And you will be using the large IR, the 14 by 17, and you put it in lengthwise. And make sure you are lined up with your bucky. And your tube is at 40 inches. Patient is in a left lateral position. You're going to bend the knees here for comfort, and you can use a translucent sponge to stick here just between the knees. A little more comfortable there for the patient. Lead mask behind the patient to help with your scatter radiation. And to make sure they're in a true lateral, you're going to bring them back, straighten up the spine, and make sure the hips and shoulder are in parallel to each other. So the knees are bent, the arms are up in a praying position. You have the pillow under their head, and you're going to align mid-coronal. So once your tube and your bucky are lined up, you just make a table from there. You're going to go mid-coronal, and because you're using the large IR, you're going to just center at your iliac crest, which is about here. And make sure you collimate on your sides, your lateral sides, to ensure the pelvis and your torso are in a true lateral. Again, just make sure that the hips and the shoulder are in line. Light is just kind of skimming the back. Bring it back a little bit right here. And then go ahead and mark your side of interest. Here, just kind of out of the way. You're going to suspend on expiration. Have your patient take a breath in, let it out, hold their breath, and expose. And for this particular view, your anatomy demonstrated is your intervertebral foramina, L1 to L4, vertebral bodies, intervertebral joints, spinous process, L5 to S1, depending on the IR size that you use.
All right, the final projection we're going to be doing is the lateral L5-S1, or what some people refer to as the spot. We're going to be demonstrating the L5 vertebral body and then the first and second sacral segments, and we want to make sure that L5-S1 joint is open. We're going to be using a smaller IR for this. You can use the 8x10 or the 11x14, and we're going to maintain our 40-inch distance with the bucky. We're going to have our IR in here and make sure that it's lined up and ready to go. Your patient should already be in the lateral position from their lateral lumbar, so we're just going to make sure that she is still in true lateral. So ma'am, I'm just going to move you. We want to make sure that the hips and the shoulders are aligned. Okay, we're going to still have our lead mat behind our patient to help with scatter. We're going to use an angle for this. You may or may not, depending on how well the waist is supported. But since we want that L5-S1 joint open, I'm going to go ahead and use a 5-degree angle claudette. You can use 5 to 8 degrees, so we're going to angle it towards her feet. For this, you're gonna aim your CR 1.5 inches below the crest and 2 inches posterior to the ASIS. So let's make sure that she's lined up. Ma'am, I'm gonna feel your hip so that we can get you lined up. Okay, so we're going 1.5 inches below the crest and then about 2 inches posterior to the ASIS. And we're gonna collimate down because we just need that L5 and then we want all the way to the sacrum. We're gonna put our left marker on there because she's in a left lateral position. All right, since I angled my tube, we wanna make sure again that we're just aligned with the buggy. So if we have to, we can scoot it over since we did use an angle. If you're not using digital equipment, you wanna make sure that it's aligned. Then I'll set my technical factors at 90 to 100 kV, and then I will expose on expiration.